In 2010, a historian searching through old medical archives made a discovery that would shock the world. Buried in dusty boxes were documents proving that between 1946 and 1948, the United States government deliberately infected over 1,300 Guatemalan citizens with syphilis and gonorrhea. Without their knowledge, without their consent, prisoners, mental patients, soldiers, orphans. They were used as human lab rats in one of the most horrific medical experiments in history, and it was hidden for over 60 years. March 2010, Professor Susan Reverby of Wellesley College was researching the Tuskegee syphilis study when she stumbled upon a box of papers in a Pennsylvania archive. The papers belonged to Dr. John Cutler, a U.S. Public Health Service physician who had worked on both the Tuskegee study and another project, a project that had been completely hidden from history. As Reverby read through Cutler's notes, her hands began to shake. These weren't just observations of naturally occurring disease. These were detailed records of deliberate infection. Pages and pages documenting how American doctors traveled to Guatemala and systematically infected vulnerable people with deadly sexually transmitted diseases. Prostitutes were infected and then sent to have sex with prisoners and soldiers. When that method was deemed too slow, doctors moved to direct inoculation. They scraped the skin off prisoners' penises and poured infected pus directly into the wounds. They infected women and then encouraged them to pass the disease to others. They infected children in orphanages, mental hospital patients who couldn't consent, indigenous Guatemalans who couldn't read the consent forms that were never really consent forms at all. This wasn't medical observation. This was medical torture, and it was approved, funded, and executed by the United States government. What you're about to hear isn't Nazi experimentation. This wasn't Dr. Mengele. This was American doctors trained at prestigious universities, funded by the U.S. Public Health Service, deliberately infecting innocent people with disease. And when their experiment was over, many were never treated. Many never knew what had been done to them, and many died. To understand how this happened, we need to go back to 1946. World War II had just ended. Penicillin had been discovered and was revolutionizing medicine. But there was a problem. Sexually transmitted diseases were still ravaging the military. During WWII, the U.S. military lost more man-days to STDs than to combat injuries. Syphilis and gonorrhea were epidemic. The military desperately wanted prophylactic treatments, something soldiers could use immediately after exposure to prevent infection. But testing prophylactics meant deliberately exposing people to disease and then trying to prevent infection. You couldn't do that ethically. You couldn't get real consent from people to be intentionally infected with syphilis. Not in America. Not after the Nuremberg trials had just exposed Nazi medical experiments and led to the Nuremberg Code of Medical Ethics. So the U.S. Public Health Service looked elsewhere. They needed a place where 1. Authorities could be bought. 2. Subjects were vulnerable and powerless. 3. Operations could be kept secret. 4. Medical records could be controlled. They found Guatemala. Why Guatemala was chosen? In 1946, Guatemala was under the dictatorship of Juan José Arevalo. His government was friendly to the United States. American influence in Guatemala was strong through the United Fruit Company, which essentially controlled the country's economy. More importantly, Guatemala had large institutional populations, prisons, mental hospitals, military barracks, where the government controlled every aspect of people's lives. These institutions were overcrowded, underfunded, and desperate for any help. When American doctors arrived offering medical care and money, they were welcomed. The Guatemalan government was told the Americans were conducting prophylaxis studies. They were not told the full extent of what that meant. They certainly weren't told that their citizens would be deliberately infected with deadly diseases. The team. The experiments were led by Dr. John C. Cutler of the U.S. Public Health Service. Cutler had previously worked on the Terre Haute prison experiments in Indiana, where prisoners were deliberately infected with gonorrhea. He would later become a leading figure in the Tuskegee syphilis study. Funding came from U.S. Public Health Service, National Institutes of Health, Pan American Sanitary Bureau, precursor to Pan American Health Organization. The experiments were approved at the highest levels of the U.S. Public Health Service. This wasn't a rogue doctor. This was official policy. But how exactly did they infect people? The methods they used were so brutal, so violating, that even reading the clinical descriptions is disturbing. The declassified documents reveal a progression of infection methods, each more invasive and violent than the last. Phase 1. Indirect infection through prostitutes. Initially, the researchers tried what they called the natural method. They infected prostitutes with syphilis or gonorrhea, then sent these women to have sex with prisoners, soldiers, and mental patients. From Dr. Cutler's notes, we selected female commercial sex workers who agreed to participate. We infected them with syphilis and gonorrhea through direct inoculation, then arranged for them to have intercourse with subjects. Think about what that means. These women were deliberately infected with disease, then sent to unknowingly transmit it to men who also didn't know what was happening. The researchers controlled every aspect: when, where, how many times. This wasn't sex. This was weaponized rape facilitated by doctors. But this method was too slow. Not enough men were getting infected. The transmission rate wasn't high enough for the researchers' timeline, so they escalated. Phase 2. Direct inoculation, scraping, and infection. The declassified documents describe the procedure in clinical language that can't hide the horror. The subject's penis was scraped to create an abrasion. Infected material, pus containing live syphilis bacteria, was then applied directly to the abraded area. They physically wounded the men, then poured disease directly into the open wounds. The documents describe subjects screaming, trying to resist, being held down. Some subjects were given alcohol first, not as anesthesia, but to make them more compliant. Phase 3. Intradermal and subcutaneous injection. When scraping wasn't efficient enough, they moved to injection. They would inject concentrated bacteria into the penis, under the skin of the penis, into the urethra, into the forearm, into the spinal column for neurosyphilis studies. One document describes injecting viable treponema pallidum directly into the substance of the penis. That's injecting live syphilis bacteria directly into the tissue of the penis. The pain must have been excruciating. Phase 4. The mental hospital experiments. The most disturbing experiments happened at Guatemala's National Mental Health Hospital. Here, the subjects couldn't consent. Many couldn't even comprehend what was being done to them. Dr. Cutler's notes describe infecting mental patients who were psychotic and unable to understand, epileptic and frequently seizing, developmentally disabled, described in the notes as imbeciles and idiots, clinical terms of the era, but revealing the doctor's attitude. They infected these vulnerable people, monitored the progression of disease, and in many cases never treated them. The researchers wanted to see the full disease progression. Treatment would ruin the study. The children. Perhaps most horrifying, they experimented on children in the National Orphanage, children who had no families to protect them, children who trusted the American doctors. From the declassified documents, we had the opportunity to observe the therapeutic effects in a group of juvenile subjects at the National Orphanage. Opportunity. That's what they called infecting orphan children with syphilis, an opportunity. The infection was just the beginning. What happened next reveals the true purpose of these experiments and why so many people were left to suffer. The stated purpose of the Guatemala experiments was to test prophylactic treatments, medications or procedures that could prevent STD infection if used immediately after exposure. They tested various compounds: orvismafarsin, a soap containing arsenic; calomel ointment, mercury-based; various sulfa drugs; early antibiotic preparations; silver preparations. The experimental protocol was: 1. Infect the subject with syphilis or gonorrhea. 2. Apply the prophylactic treatment at various intervals, immediately, 1 hour later, 3 hours later, etc. 3. Monitor to see if infection was prevented. 4. If infection occurred, document the progression. Here's the problem. For the experiment to be successful, some subjects had to get infected and not be treated. You need a control group. You need to see what happens when the prophylaxis fails. You need people to develop full-blown disease so you can compare treatment versus no treatment. The untreated control groups. The declassified documents reveal that approximately 30% of infected subjects received no treatment whatsoever. They were deliberately left to develop advanced syphilis and gonorrhea. Why? Because researchers wanted to document the natural progression of the disease. They wanted to see secondary and tertiary syphilis develop. They wanted to observe neurological damage, organ failure, and death. Dr. Cutler's notes describe subjects with chancres, open sores covering their genitals; secondary syphilis rashes; neurological symptoms suggesting neurosyphilis; signs of organ damage; and in the margins, clinical observations. Subject shows expected progression, neurological involvement confirmed, terminated observation due to death. Terminated observation, not patient died. The person wasn't a patient. They were an observation, an experiment, a data point. Inadequate treatment for others. Even subjects who received treatment often got inadequate doses. The researchers wanted to find the minimum effective dose of various drugs. That meant some subjects got too little medication to cure the infection completely. From the documents, we administered subtherapeutic doses to determine minimum effective levels. Subtherapeutic, deliberately insufficient. These people weren't being treated. They were being used to calibrate dosing for future patients. And if that meant permanent disability or death, that was acceptable, because they weren't seen as people. They were experimental subjects. The experiments continued for 2 years. Over 1,300 people were infected. But then suddenly, in 1948, the experiment stopped. Why? Not because of ethical concerns. In 1948, after 2 years of operation, the Guatemala experiments were abruptly terminated. The declassified documents reveal why, and it had nothing to do with moral awakening. The Tuskegee connection. Dr. Cutler had been running parallel experiments. While conducting the Guatemala studies, he was also working on the Tuskegee syphilis study in Alabama. Tuskegee involved observing the natural progression of untreated syphilis in black men, without telling them they had the disease and without treating them, even after penicillin became available. Tuskegee had been running since 1932. By 1948, some medical professionals were beginning to question its ethics. If word got out about Guatemala, about deliberate infection rather than just observation, the controversy could expose Tuskegee as well. The Nuremberg problem. The Nuremberg trials had concluded in 1947. The Nuremberg Code had been established, laying out clear ethical principles for medical research. Voluntary consent is absolutely essential. Experiments should avoid unnecessary physical and mental suffering. No experiment should be conducted where there is reason to believe death or disabling injury will occur. The Guatemala experiments violated every principle of the Nuremberg Code. If exposed, American researchers would be held to the same standard as Nazi doctors. The irony, The hypocrisy would be devastating. The risk of exposure. By 1948, too many people knew about the Guatemala experiments. Guatemalan medical staff, administrators, military officials. There were records, photographs, medical charts. The more people who knew, the greater the risk of exposure. Someone in the U.S. Public Health Service. The documents don't reveal exactly who made a decision. Shut it down, destroy evidence, classify everything, and never ever speak of it again. The cover-up begins. The shutdown protocol was thorough. 1. All subjects were released from the study with no follow-up care. 2. Many were never told they had been infected. 3. Those who were symptomatic were given minimal treatment, just enough to reduce visible symptoms, not enough to cure. 4. Records were classified confidential. 5. Guatemalan medical staff were told to destroy local records. 6. U.S. researchers were forbidden from publishing their findings. 7. The Guatemalan government was told the study had concluded successfully and all subjects had been treated. All lies. Many subjects went home to their families, unknowingly carrying syphilis or gonorrhea. They would infect their spouses. Their children would be born with congenital syphilis. The damage would spread through generations. For 62 years, the secret held. Dr. Cutler died in 2003, never facing consequences. The Guatemalan victims grew old, suffered, and died, never knowing what had been done to them. And then a historian opened a box. In 2010, Professor Susan Reverby was researching the Tuskegee syphilis study for a book. She was examining the papers of Dr. John Cutler, which had been donated to the University of Pittsburgh archives after his death. She expected to find more information about Tuskegee. What she found was something far worse. The archive boxes. Cutler had kept everything: detailed notes, photographs, statistical tables, correspondence with U.S. Public Health Service officials, budget documents, lists of subjects with their infection status and treatment records. He had meticulously documented every aspect of the Guatemala experiments. Perhaps he intended to publish someday. Perhaps he thought the research was too valuable to destroy. Or perhaps he simply didn't see anything wrong with what he'd done. The documents revealed 308 people deliberately infected, 678 infected with syphilis, 772 infected with gonorrhea, some received both, 219 never received adequate treatment. At least 83 died during or shortly after the experiments. But those numbers are conservative. Many subjects were released without follow-up. We don't know how many died later from untreated syphilis, how many infected their families, how many children were born with congenital syphilis and died in infancy. Reverby goes public. Reverby was horrified. She immediately contacted the CDC and the Presidential Commission for the Study of Bioethical Issues. She presented her findings at academic conferences. She published her research. The response was swift and powerful. The government response. October 1, 2010. Secretary of State Hillary Clinton and HHS Secretary Kathleen Sebelius issued a joint statement. Although these events occurred more than 64 years ago, we are outraged that such reprehensible research could have occurred under the guise of public health. We deeply regret that it happened, and we apologize to all the individuals who were affected by such abhorrent research practices. President Obama called Guatemalan President Alvaro Colom to personally apologize. But apologies weren't enough. Obama commissioned a full investigation by the Presidential Commission for the Study of Bioethical Issues. The Presidential Commission investigation. The commission spent a year investigating. They reviewed over 125,000 archived documents, medical records from Guatemala, budget documents, correspondence between researchers and government officials, Ethical Guidelines of the Era. Their September 2011 report titled Ethically Impossible: STD Research in Guatemala from 1946 to 1948 concluded. The Guatemala experiments involved unconscionable basic violations of ethics, even as judged against the researchers' own understanding of applicable contemporaneous practices. Translation: even by 1940s standards, before modern ethical review boards, this was wrong. The researchers knew it was wrong. They did it anyway. The findings. The commission discovered that the experiments were worse than even Reverby's initial research had shown. Scale: 5,500 Guatemalans were enrolled in the studies, though only 1,308 were deliberately infected. The others were used as controls or for observation studies. Informed consent. In no case was adequate informed consent obtained. Subjects were told they were receiving health care or preventive treatment. They were never told they would be deliberately infected. Vulnerable populations. Deliberately targeted the most powerless. Prisoners who faced consequences for refusing. Mentally ill patients who couldn't consent. Soldiers who couldn't refuse orders. Commercial sex workers who were coerced. Orphaned children who had no advocates. Approval at highest levels. The Surgeon General was informed. The experiments were funded through official channels. This wasn't rogue researchers. This was government policy. Deliberate secrecy. Researchers knew what they were doing was wrong. They used code names, destroyed evidence, and deliberately kept the experiments secret even from other doctors. The world was horrified. But for the victims and their families, horror wasn't enough. They wanted justice. They wanted compensation. What they got was a legal battle that revealed just how little recourse victims of government experiments have. In 2011, victims and family members filed a lawsuit in U.S. federal court, Garcia v. Sebelius. They sued for compensation for victims, medical care for survivors, compensation for family members who were infected by victims, punitive damages. The lawsuit represented 444 victims and their family members, but it never went to trial. The sovereign immunity defense. The U.S. government moved to dismiss the case based on sovereign immunity, the legal doctrine that the government cannot be sued without its consent. The government's argument. 1. The experiments happened in Guatemala, not the U.S. 2. The victims were not U.S. citizens. 3. Sovereign immunity protects the U.S. from lawsuits for actions abroad. 4. The Federal Tort Claims Act doesn't apply to actions in foreign countries. In January 2012, U.S. District Judge Reggie Walton dismissed the lawsuit. His ruling acknowledged the horrific nature of the experiments but concluded that the court lacked jurisdiction. Walton wrote, "The court's dismissal of the case is by no means a decision that the actions of the United States in conducting the Guatemala study were in any way justified. But justified or not, the victims had no legal remedy." The appeals. The victims appealed to the D.C. Circuit Court of Appeals. In 2013, the appeals court upheld the dismissal. The reasoning was the same: sovereign immunity, lack of jurisdiction, experiments conducted abroad. They appealed to the Supreme Court. In 2013, the Supreme Court declined to hear the case without comment. Legal avenues exhausted. No compensation, no justice, just apologies. The Guatemalan government's response. Guatemala filed its own lawsuit in international court. In 2015, Guatemala asked the International Court of Justice to rule on the case. But the ICJ also declined jurisdiction, noting that Guatemala would need U.S. consent to bring the case, which the U.S. refused to give. The message was clear: powerful countries can commit atrocities with impunity as long as the victims aren't citizens and the crimes happen abroad. No compensation, no punishment, just apologies. But the story doesn't end there, because what happened in Guatemala wasn't unique. As researchers dug deeper into medical archives following the Guatemala revelations, they discovered something disturbing. Guatemala wasn't unique. It was part of a pattern. The Terre Haute Prison Experiments, 1943-1944. Before Guatemala, Dr. Cutler ran experiments at a federal prison in Terre Haute, Indiana. There, he deliberately infected prisoners with gonorrhea to test treatments. The prisoners were told they were volunteers and would receive treatment. Many didn't receive adequate treatment. The Holmesburg Prison Experiments, 1950-11974. At Holmesburg Prison in Philadelphia, Dr. Albert Kligman conducted decades of experiments on mostly black prisoners. Exposed prisoners to dioxin, Agent Orange component. Tested pharmaceutical drugs. Exposed subjects to chemical warfare agents. Caused permanent scarring and health damage. Prisoners were paid minimal amounts. Consent was coerced. Many suffered permanent damage. The Willowbrook State School Experiments, 1956-1970. At a New York institution for developmentally disabled children, researchers deliberately infected children with hepatitis to study the disease. Parents were told their children would receive better care if they consented to the vaccine program. They weren't told their children would be deliberately infected. The Stateville Penitentiary Malaria Experiments, 1940-1963. At an Illinois prison, researchers infected inmates with malaria to test treatments. Over 400 prisoners participated. While technically volunteers, the coercive nature of the prison environment calls consent into question. The Jewish Chronic Disease Hospital Case, 1963. Researchers injected live cancer cells into 22 elderly patients without their knowledge or consent to study immune response. The patients were never told they were receiving cancer cells. The pattern. What all these experiments share. 1. Vulnerable populations. Prisoners, children, the disabled, the poor, minorities. 2. Lack of true consent. Coercion, deception, or no consent at all. 3. Government funding. NIH, Public Health Service, military. 4. Official approval. These weren't rogue doctors. Institutions and agencies approved. 5. Secrecy. Experiments were hidden or their full nature concealed. 6. Lack of accountability. When exposed, officials faced minimal consequences. The Guatemala experiments weren't an aberration. They were part of a system that viewed certain people as acceptable experimental subjects. The exposure of the Guatemala experiments had profound effects on medical ethics, research oversight, and international law. Strengthened oversight. The Obama administration's Presidential Commission made 14 recommendations. 1. Strengthen informed consent protections. 2. Improve oversight of international research. 3. Require ethics review for all government-funded research abroad. 4. Create whistleblower protections for researchers who report unethical practices. 5. Establish compensation mechanisms for victims of unethical research. Some have been implemented, others remain recommendations. The Common Rule revisions. In 2018, the U.S. revised the Common Rule, federal regulations governing human subjects research. New protections included enhanced informed consent requirements, additional protections for vulnerable populations, requirements for long-term follow-up, provisions for international research ethics review. The Guatemala case was specifically cited as justification for these changes. International standards. The World Medical Association revised the Declaration of Helsinki, the International Ethical Code for Medical Research, to specifically address research in low-resource settings, protections against exploitation, post-trial access to treatment, Community consent requirements. The compensation fund that never was. Despite calls for compensation, no fund was ever established for Guatemalan victims. The U.S. provided $1.8 million for health care for survivors, administered through Guatemalan institutions, but no direct compensation to victims or families. Compare this to Tuskegee survivors received a $10 million settlement in 1974, equivalent to $60 million today. Japanese Americans interned during WWII received $1.6 billion in reparations. Radiation experiment victims received $4.8 million in 1996. Guatemalan victims, nothing, because they weren't American citizens, because sovereign immunity protected the U.S. government, because power determines justice. The declassified documents contain subject numbers, not names. Subject 352, female subject 44, juvenile subject 7, but these weren't numbers, they were people. Berta, female subject 152, was a woman named Berta. She was a patient at the National Mental Health Hospital. Records show she had epilepsy. She was 19 years old when Dr. Cutler's team infected her with syphilis. She was never treated. Dr. Cutler's notes indicate she expired 3 months after infection. Expired, like a parking meter, like a grocery coupon. Her family was never told what happened. They thought she died from epilepsy. They never knew American doctors had deliberately infected her with disease and watched her die. Federico. Subject 926 was a soldier named Federico. He was 23. He was told he would receive preventative treatment for STDs. Instead, he was deliberately infected with gonorrhea through direct inoculation. He received partial treatment, not enough to cure the infection completely. He was discharged from the study and returned to his unit. Records indicate he later infected his wife. She miscarried. Medical notes suggest the miscarriage was likely due to gonococcal infection. Federico never knew he'd been deliberately infected. He blamed himself for his wife's miscarriage. He lived with that guilt until he died in 1998, never knowing the truth. The Orphans. We don't even know most of their names. Juvenile subjects at the National Orphanage. Children ages 6-14. Infected with syphilis under the guise of health care. Some received treatment, some didn't. Records are incomplete. We don't know how many died. How many were adopted into families carrying disease? How many lived with permanent damage? The Guatemalan government has tried to trace these children. Most are probably dead now. They'd be in their 80s if still alive. But some families have come forward. They describe relatives who had unexplained health problems, neurological issues, blindness, all symptoms of untreated syphilis. How many of these symptoms were caused by American doctors in 1948? We'll never know. Today, the documents from the Guatemala syphilis experiments are fully declassified. You can read them online. The Presidential Commission's full report is public. The photographs, the medical notes, the budget documents, all available. The truth is no longer hidden. But for the victims, truth isn't justice. In 2023, 75 years after the experiments, the last known survivor died. Her name was Francisca. She was 11 years old when American doctors infected her. She was never treated. She lived with chronic health problems her entire life. She died without ever receiving compensation, without anyone being held accountable, with nothing but an apology from a government that claimed it couldn't be sued. The researchers who conducted these experiments. Dr. Cutler died in 2003, having spent his career as a respected professor. He was never charged with a crime. No one involved ever faced criminal prosecution. No one lost their medical license. No one went to jail. The institutions that enabled this. The U.S. Public Health Service became the CDC. The National Institutes of Health continue to fund research worldwide. The Pan-American Health Organization still operates in Latin America, all still operating, all with increased oversight, yes, but also with immunity from their past crimes. The legal precedent set by the Guatemala case dismissals, still standing. The U.S. government still claims sovereign immunity for actions abroad. Future victims of government experiments in other countries have no legal recourse. The message is clear. As long as you victimize foreigners on foreign soil, you're protected. We say never again after every atrocity, after Guatemala, after Tuskegee, after Holmesburg, after every exposure of medical abuse. We update ethical guidelines, we strengthen oversight, we promise reform. And yet, in 2010, just as the Guatemala experiments were being exposed, new controversies emerged. Reports of pharmaceutical companies conducting poorly regulated clinical trials in India and Africa. Reports of prisoners in the U.S. still being used for medical experiments. Reports of immigrants in detention being given unnecessary hysterectomies. The names change, the locations change, but the pattern remains: the powerful experiment on the powerless. The Guatemala files are declassified. The truth is documented. The victims are identified. The apologies have been issued. But the people who did this, they're dead unpunished, their reputations intact. The institutions that enabled this, still operating, still powerful, still protected by sovereign immunity. And the victims, they're dead too, compensated with nothing but words, justice denied by jurisdictional technicalities. The files say declassified, but justice remains classified, filed away, beyond reach, protected by sovereign immunity and the cold mathematics of power, that some lives matter and some don't, that some people are citizens with rights and others are experimental subjects with numbers.